Living with and beyond cancer. There's a lot of talk about cancer these days, and it seems that more people are being diagnosed with it. Is that true?
It is true that more people are talking about it, that's for sure. We're much more open about being able to talk about cancers. There are more people being diagnosed as well, and that's largely because we're an ageing population and people are living longer. The longer we live, the more opportunity there is to develop a cancer. So it means that we're exposed to it a lot more. We have a lot more friends, family, colleagues that we're aware of who've had cancer diagnoses.
So what's this going to mean in the future if more people have got cancer?
It means we're going to be talking about it even more.
Okay.
It's going to be more prevalent, and people are going to be much more aware of friends, family members who've had cancers and the consequences of the treatments.
Okay. So if this is going to happen, who's going to look after us? Who's going to help us with this?
There's a whole host of people. There are people in the community through the GP practices, and there's teams of nurses and doctors and all sorts of other health professionals in hospitals who are specialised in looking after people with cancer.
Okay.
So to join all these teams together, Macmillan have developed something that they call the recovery package.
So I've heard about the recovery package, so tell me a little bit about it.
Well, it's four main components. The first one is all about the holistic needs assessment, which is about the individual, what their particular needs are and concerns, and ultimately to help to address those. But obviously people need to tell us what they are. The second part is a treatment summary. So that summarises what they've been through, what treatments they've had. And the idea behind that is that they have a copy of that and a copy goes to their GP.
Well, that comes to me,
So that they can work together to help support them in the future. The third part is something called a health and wellbeing advice day. Things like coming to events like today. Either coming to an event like this, getting some information from a DVD or from a clinic. There's all sorts of different ways that they can get all of that. And the fourth part is cancer care review.
And that occurs in
the
primary
community.
care.
Yeah. So when a patient's discharged from hospital care and returns to be looked after by their GP in the community, what happens next?
Some patients return to be looked after completely by their own GP. Other people have a shared care arrangement between the hospital and the GP, and that should have been documented and discussed in the treatment plan that's come from the hospital. The patient will also have a copy of that, which will be very useful for them to review back to. Every patient with a new diagnosis of cancer should be offered a cancer care review in primary care with their own doctor or their nurse in the practice within the first 6 months of that diagnosis of cancer. And that's a very useful way to look again at the patient and interact with the patient and find out exactly if there are any concerns.
Will the GP contact the patient to arrange this?
The practice could contact the patients by telephone or by letter. Sometimes the practice also will telephone the patient, discuss on the telephone what the patient would like to do about the review and when they'd like it to take place. Some people find they would like a review, other people feel they don't need it, and it's completely up to the patient to say exactly what they would like. At the review, that's the time the patient can discuss any problems they're having after treatment, or any ongoing problems they might have with employment or looking at social needs as well. So it can be a very useful time to catch up with that patient.
And can the patient ask for a review?
Yes, I think it's a very good idea that the patient does ask for a review. They can then have it at the time that suits them best, when they feel they need it. And again, any ongoing problem can be reviewed again at another appointment later on. So they can have more than one review, they can come back and forth as they need to. But it's very important to identify the needs at that time. So when the patient has been discharged from the consultant care, we then need to find out how we are actually going to follow them back up in the community after that.
Well, hospitals see hundreds of people every week, and the idea behind completing treatment is that they can get on with their lives and not have to keep coming back to the hospital every 2 minutes. So they need to be cared for in the community where they're living, and the hospital therefore hands over their responsibility back to the GP to look after people. So many people are scared and feel alone after their treatment's completed and they're not going back to the hospital all the time. What should they do if they're worried about their cancer coming back?
GPs will regard cancer as a long-term condition, just the same way heart disease or kidney disease or lung disease is treated. So they're there to provide continuity of care. So patients value this continuity of care, and so we'd like them to try and find a clinician they'd like to see to give them that care. It could be a practice nurse, it could be a GP. As long as they book appointments in advance, that continuity is certainly very possible, and that's what we'd encourage people to do, to find a clinician they want to be looked after by.
But sometimes people might have a problem that they think needs dealing with urgently.
Practices offer an urgent or emergency care system every day of the week, and if patients do have a problem, they must telephone to ask for an appointment to be seen then. It would be very useful when they do telephone for the appointment, they tell the receptionist that they have got a problem, they've had ongoing cancer treatment or ongoing cancer diagnosis, and they have problems and they're worried that something has happened to do with that cancer. This enables the receptionist to give them the appointment that would suit them best with the clinician that would suit them best. So I'd be encouraging them to do that.
And sometimes patients worry that the on-call doctor might not know them very well and might not understand their concerns.
Every patient's medical records are updated regularly with all letters from the hospital, the treatment plans from the hospital, all the medication they're on. So the on-call doctor will be able to look at all that information. They'll also be able to see all the other consultations that occurred in general practice. So they'll be able to see anything else that's happened to that patient. So the on-call doctor or practice nurse should be able to offer a very good assessment of the problems that patients are having at the moment. However, they will also be able to make an appointment in advance in the future with the clinician that the patient wants to be seen in the future and followed up by.
So how should people expect to feel when they've finished their treatments?
It's normal to feel anxious and worried, and that can lead to sleep problems for lots of people. As many as 75% of patients feel very tired and exhausted, and this actually we should almost consider as normal after a cancer treatment. Also, they might notice reduced appetite and also have some pain.
Can anything be done about these problems?
Many of these symptoms improve as people get further away from the treatment and time passes. But if they continue, they definitely need to be seeking advice and help with one of the clinicians.
I've noticed that some patients will put up with an awful lot of symptoms without telling anyone.
Yeah, that's true, and particularly a feeling of tiredness can be overwhelming at times. It's really common, and it may take some time before the energy levels come back, to normal. Lots of people find it very difficult to talk about personal problems such as incontinence, but that is what GPs and practice nurses are there for, to discuss and to help with. So we'd encourage people to please come forward with these problems, because sometimes little small amounts of treatment or changes in the way things are dealt with can help tremendously.
And can anything be done to help with tiredness and fatigue?
There's good evidence that actually doing regular moderate exercise every week can help tremendously with this feeling of tiredness and lethargy. We'd encourage everybody to keep up with exercise throughout their cancer treatment and throughout their cancer recovery plan. And so we're beginning to encouraging everyone to look at this again. There's also evidence that actually keeping up with regular exercise will reduce the risk of recurrence rate of the cancer. So again, another good way to look at treating your cancer and managing it. Cancer treatment survival has never been better.
So it's really important to remember that nobody's on their own.